How can I recognize subtle stroke symptoms? Imagine feeling perfectly fine one moment and then noticing something strange the next. Recognizing subtle stroke symptoms can be life-saving because quick action can prevent serious brain damage. Some strokes show obvious signs like sudden weakness or facial drooping, but others are much more subtle and easy to miss. That's why understanding these less obvious signs is so important. A stroke happens when blood flow to part of the brain is interrupted, either by a blockage or bleeding. Brain cells start to die within minutes, so every second counts. While classic signs include weakness on one side, slurred speech, or facial drooping, many strokes present with less dramatic symptoms that can be overlooked. One subtle sign is sudden vision changes. You might notice blurry vision, double vision, or even a temporary loss of sight in one or both eyes. Some describe it as a curtain coming down over their vision. These happen because the stroke affects the part of the brain that processes what we see. If you suddenly have trouble seeing clearly or experience double vision, it could be a warning sign. Balance and coordination issues are also key. Feeling dizzy or unsteady, especially if it comes on quickly, can be a sign of a stroke affecting the cerebellum, the part of the brain that helps with balance. If you find yourself stumbling or unable to walk straight without a clear reason, it's important to take that seriously. Numbness or tingling sensations, especially on one side of the body, can be subtle signs too. While weakness is more obvious, numbness or pins and needles in the face, arm, or leg on one side might indicate a stroke. This occurs because nerve signals between the brain and body are disrupted. Suddenly feeling confused or having trouble speaking can be easy to dismiss as fatigue or distraction. But if these symptoms come on quickly and are new for you, they could be signs of a stroke. Difficulty understanding speech or finding the right words should never be ignored. A very severe but less common symptom is a sudden intense headache. Sometimes called the worst headache of your life, it can be a sign of bleeding in the brain, known as a hemorrhagic stroke. Other less typical signs include nausea, vomiting, fainting, or brief loss of consciousness, but these are less frequent. What makes stroke symptoms different from other conditions is their sudden appearance. They often come out of the blue and can worsen rapidly. Even if symptoms seem mild or go away quickly, do not dismiss them. A transient ischemic attack, or mini-stroke, can cause similar symptoms that resolve within minutes or hours, but it's a warning sign that a more serious stroke could happen soon. Immediate medical attention is essential in either case. Remember the simple acronym FAST to help recognize stroke signs quickly. Face drooping asks if one side of the face feels numb or droops when smiling. Arm weakness checks if one arm drifts downward when raised. Speech difficulty involves slurred or hard to understand speech. And time means calling emergency services immediately if any of these signs are present. An expanded version adds balance, for sudden loss of coordination, and eyes, for vision changes. Women might experience different or additional symptoms, such as sudden fatigue, nausea, fainting, or behavioral changes. These atypical signs can make recognizing a stroke more challenging, so staying aware of the full range of symptoms is vital. If you or someone nearby shows any of these signs, act fast. Do not wait to see if symptoms improve. Call emergency services immediately. Early treatment can include clot-busting medications or other interventions that can save brain tissue and lives. Conditions like migraines, seizures, or low blood sugar can mimic stroke symptoms, but the key feature is the sudden onset of neurological changes. Only healthcare professionals can make an accurate diagnosis. Preventing strokes involves managing risk factors like high blood pressure, quitting smoking, eating healthily, exercising regularly, and controlling other health conditions. Recognizing subtle symptoms is crucial, but so is taking steps to lower your risk. In summary, stroke symptoms can be subtle and vary from person to person. Sudden onset is the main clue. Use the FAST or Be Fast tools to help spot warning signs. Be especially aware that women might experience different symptoms. Even if symptoms are mild or temporary, seek emergency care right away. Remember, timely medical help can make all the difference. Always consult a healthcare professional for personalized advice and treatment. This information is meant to inform and empower you to act quickly and responsibly.